Dr. Rayfish from Vet Triage here. We are continuing through this October 2016 issue of JAVMA, and this case comes out of the vet school in Louisiana and the Ohio State University Vet School. I'll show you the blood work here. We're not going to go through the different values, but in case folks want to pause it and look at those values, you can. The study starts off with blood work. This is blood work that was collected because of complications related to cottonmouth envenomation of the muzzle of a dog 4 days prior. A 4-year-old male German wire-haired pointing Griffon was seen at the regular veterinarian for a snake bite. They gave dexamethasone, penicillin. The dog went home with amoxicillin. There were signs of swelling, pain, anorexia, vomiting. They started carprofen. The dog became further anorexic, vomiting, icterus, and had subcutaneous edema. The dog had not urinated for at least 24 hours. The blood work showed neutrophilia, azotemia, hyponatremia, hyperkalemia, and hypochloremia. They gave IV fluids and referred them to the specialty center. The dog was hypothermic, icteric, dehydrated. The muzzle was swollen and erythematous with one puncture wound by the left nares. There were oral ulcerations, pitting edema of all 4 limbs, prepuce, and the ventral aspect of neck and thorax. The skin over thorax and prepuce was darkly erythematous with evidence of sloughing. A complete blood count yielded an inflammatory leukogram and regenerative anemia, thrombocytopenia. Biochemical analysis showed severe azotemia, muscle damage, hyperbilirubinemia, hypoalbuminemia, and elevated liver values, hyperkalemia, and hyponatremia. Ultrasound-guided kidney biopsy was performed, and the histopathologic findings include the lumens of collecting ducts were mildly dilated and contained granular to globular casts. The interstitium was expanded with edema, scattered aggregates of neutrophils and macrophages. There was a pigmentary nephropathy secondary to snakebite envenomation with red globular material consistent with hemoglobin and myoglobin pigments in the collecting ducts and sloughed cellular debris. So these red areas here are within the collecting ducts, and those are called casts, which is any material that's in the lumen. It doesn't have to be myoglobin or hemoglobin. It could be anything, sloughed epithelial cells, for example, protein, things like that. So the diagnostic interpretation was acute tubular necrosis with intratubular red granular casts consistent with either hemoglobin or myoglobin. They're saying that it's not possible for them to determine what's hemoglobin or myoglobin without further histological staining. The case summary was a pigmentary nephropathy secondary to Crotalid envenomation, which is this snake here, cottonmouth or water moccasin. The scientific name is Agkistrodon piscivorus. Comments. The cottonmouth or water moccasin is a crotalid snake with hemotoxic and proteolytic venom. Reported hematologic changes associated with crotalid envenomation include echinocytosis, thrombocytopenia, hemolysis, coagulopathy. Hemolysis is preceded by erythrocyte swelling with an increase in hematocrit and may be delayed for up to 1 to 3 weeks after the snake bite. The overall mortality rate for snake envenomation in dogs is as high as 19%. Death secondary to nephropathy from envenomation has not been reported in the veterinary literature. Hemolysis causes bilirubinemia, leading to bilirubinuria, and in dogs, pigmentary nephropathy is rarely reported and is very uncommon, secondary to snake envenomation. In one study, acute renal failure was reported in 1 of 31, or 3% of dogs, after envenomation by eastern diamondback rattlesnakes. There is a single report of pigmentary nephropathy in a dog secondary to envenomation by a myotoxic hemolytic neurotoxic snake, the red-bellied black snake, scientific name Pseudechis porphyriacus. And this case was diagnosed based on excellent quality of the biopsy samples collected. In the United States, there are only 2 snake species, the rattlesnake and the moccasin, that are hemotoxic, causing pigmenturia in bite victims. There are no myotoxic snakes in the United States. However, the proteolytic nature of some venoms can also induce muscle degeneration and increase pigment load. It is impossible to distinguish hemoglobin from myoglobin casts in histologic samples. In human nephropathology, immunohistochemical analysis is used for definitive identification of the pigment. In 31 dogs with snake bites, anemia attributed to intravascular hemolysis developed in 23% of dogs, with another 23% having unclassified anemia, some of which were severe. Dogs may not develop secondary pigmentary nephropathy if promptly treated with antivenin. It is important to be aware that acute renal failure can have a delayed onset and that dogs with snake bites could be monitored and treated immediately if clinical signs do develop. In the human literature, a mortality rate of 1 to 20% is reported with snake bite nephropathy. With intensive care, usually some form of dialysis, recovery for humans with snake bite nephropathy occurs within 2 to 3 weeks, but it could be longer if there's more damage to the kidneys. This dog received a combination of continuous renal replacement therapy and intermittent hemodialysis over 11 days. The renal function improved by day 10, peak urinary output by day 15. 4 months later, the dog was normal. Acute kidney injury can have a guarded to grave prognosis. However, histologic examination of renal biopsy specimens is helpful in assessing the damage to the kidneys and determining prognosis. The histologic findings indicated that the acute kidney injury was reversible and because scarring had not yet developed. So this is a crazy case. I would never would have thought about biopsying kidneys early on or even at all for this, because I would have thought the dog is too unstable when it came in to be sedated and then get the biopsy. I assume the kidney biopsy is under sedation or even general anesthesia. And then for those who are listening to this and watching this, don't forget too, there are many other causes of pigment nephropathy as well, not just snake envenomation. For example, if you have severe muscle trauma from intense seizures or prolonged seizures in dogs, all that seizure activity, convulsions, is going to cause muscle damage, and that can lead to the same pigment nephropathy that they described here. So very interesting case. And we don't see a lot of snake bites, I suppose, in the U.S., but in other areas of the world, like Australia, they're almost always emergencies. They're very common and quite life-threatening. So cool case. All right, we'll see you guys tomorrow. Bye-bye.